It's just a most enormous pleasure for me to join this meeting, and I'm grateful for the opportunity. As Owen Lloyd said, we've been through very difficult times this last 2 years. There has been, somebody described it as a global shiver. And the times have been terribly tragic and terribly frightening during the course of the last 2 years. And when human beings experience great difficulty, there are also times we know where there are opportunities for huge learning and growth. And I think it's really important that we, all of us, take the time now to reflect as individuals, human beings, as communities, as organizations, as societies, on what we can learn from this last 2 years. But I think it's important to recognize, to go back further than the pandemic, and to recognize that even before the pandemic, the levels of stress amongst people working in education, in schools, amongst leaders in schools, were among the highest levels of stress of any groups in industry in our society, and had been so for many years. I think it's really important we think about the future. We don't make the mistake of simply thinking about how do we emerge from the difficulties of the pandemic, but we think about how we can transform our teams, our organizations, our schools, our societies indeed, for the long-term future. And I think the most important lesson that we have learned from the last 2 years has been the lesson of compassion. The compassion that teachers, that healthcare workers, that other frontline workers have shown in caring for those they provide education for, provide healthcare for, provide social care for. People have risked their lives, particularly in the early days of the pandemic. And sadly, many colleagues in those frontline services and in schools lost their lives in the course of this last 2 years. And we've seen the compassion that colleagues have shown to each other. What we've learned, particularly from the work I've been involved with in healthcare, is that across the system, what has sustained people over this period of time has been the support of their colleagues, the teams they work in, that has enabled them to cope during this enormously difficult time. And the compassion the community has shown, that what we've seen is a huge upwelling of compassion in the community. My mum, who was born in Llansamlet, who now lives 10 minutes away from me in Sheffield, had so many neighbours dropping in to see if they could do her shopping for her or anything that she needed. And that was true across the country. And it's typical of what we see during human disasters and crises, that often political elites believe people will be selfish, they will loot, they'll riot, they won't collaborate. But in fact, the truth is, a magisterial book, A Paradise Built in Hell by Rebecca Solnit tells us, is that in these times of crises, communities show an upwelling of compassion. So what can we learn about this compassion? Well, what does it mean, first of all? For me to be compassionate to somebody in pain or distress or fear, I have to do 4 things. I have to attend, understand, empathize, and help. And attending means being present with the other, giving my attention. Nancy Klein has a wonderfully evocative phrase, listening with fascination. And second, I have to seek to understand the challenges that the other person is facing. And I achieve that understanding through having a dialogue rather than just imposing my understanding. And third, I have to have an empathic response. I have to feel the other's pain without being overwhelmed by it, without making it my drama, because that gives me the motivation for the 4th element of compassion, which is helping or serving the other person. And we know from neuroscience studies that there's a real difference between empathy alone and compassion, with that additional critical helping component. When we ask people to be compassionate and we use functional magnetic resonance imaging technologies to see what's going on in the brain, we see that empathy is associated with the activation of various pain centers in the brain. And that makes sense because we're mirroring the other's pain. When we ask people to be compassionate, that's associated with the activation of reward centers in the brain. And that makes sense because 99% of us have been hardwired by evolution to be compassionate to others in pain or distress or difficulty. Why? Because over our evolutionary history, it enabled us to form supportive social groups, tribes, families. Compassionate leadership, compassion is a way of connecting, a way of blurring the boundaries between self and other, a way of creating that feeling of belonging that is at the heart of communities, and I believe particularly of Welsh society. Belonging is so important to us as a species. You know, after all, we're as likely to die from the effects of loneliness as we are from the effects of smoking or obesity. And we also know a lot more now about the role of compassion in healthcare, which gives us insight to how important compassion is in our human experience. And I want to show you just a few examples of some of the findings from the many hundreds of studies that have been conducted over recent years. And this is just, rather than being a summary, it's a representative sample of the findings that we see from research in healthcare. I'm just going to check, first of all, that Tegwyn, can you see the slides okay now? Great, thank you. So these are all based on what are called randomized controlled trials, as a sort of gold standard of medical research, or meta-analyses, where all of the data from studies on a particular subject are combined to give us an overall picture. And the first is large randomized controlled trial of visits by anaesthetists to patients prior to surgery, where they either give sedatives, they have a normal visit and give sedatives, or they visit but don't provide sedatives, but they are extra compassionate. And what we see is that in that compassion intervention, patients are calm, but they're not drowsy, whereas the reverse is true for the normal visit. But what's particularly significant as well is the much lower requirement those patients who receive the compassion intervention have for painkillers post-surgically, and they have a significantly shorter length of hospital stay. And that's a hugely important issue in health services. The second is a study of patients with an early diagnosis of non-small cell lung cancer, randomly assigned to either normal early cancer care or to normal early cancer care plus extra, plus early palliative care, which is, if you like, is extra compassionate care. And it was a study of quality of life, which indeed found that quality of life was much better for the patients who were assigned to early palliative care. But what was a complete surprise to the researchers was the finding that they also lived significantly longer. And we see similar large effects of clinician compassion in the treatment of long-term disorders like diabetes or HIV, and of therapist compassion in the treatment of mental health problems. The majority of clinicians, I think, understand the importance of compassion, though they say, well, it just takes too long. But in fact, the research shows that it doesn't need to take any longer. And in general, compassion doesn't take any longer in our interactions. But what's also really important to understand, and consistent with what I was saying about the neuroscience studies earlier, is that when we ask general practitioners or nurses in randomized controlled trials to be extra compassionate in their interactions with patients or service users over a 2-week period, that has a significant impact on their own mental health, on their own well-being, lower levels of anxiety, stress, and depression. So we benefit from being compassionate to others. And I guess the lesson that emerges from this is that compassion is the most important intervention there is in healthcare. Actually, you could argue that it's the most important human interaction that there is. And the effect sizes are truly remarkable, greater than the effects of aspirin, commonly used early in the treatment of heart attacks, and of statins in the 5-year risk of a cardiovascular event. So extrapolating from this, I think the challenge for us in educational organizations, given our commitment to seeking to create the conditions where students, where learners can grow, can fulfill their potential, can live as happy and fulfilling lives as possible. How do we create the conditions within our organizations where staff will interact with learners in a compassionate way, attending, understanding, empathizing and helping, where staff will behave towards each other in that way, and indeed where they'll turn, if you like, that warmth of compassion on themselves and be self-compassionate? Well, the answer to that question is it's about the culture of organizations. And how do we shape culture? Well, every interaction that every one of us has every day is an opportunity to shape the culture of our teams, of our schools, of our communities, of our families, because the emotional ripples spread out through a kind of, if you like, emotional contagion. But we know also from the last 100 years of research on culture in organizations that the role of leaders, formal leaders, informal leaders, is particularly powerful. And actually, I believe all teachers are leaders in schools. We know that leaders play a huge role in shaping culture. What leaders pay attention to, what they focus on, what they praise, what they celebrate, and particularly what they portray in their own behavior, tells those they lead what it is that's important to them. Whatever words we have on the website about values and vision, what leaders pay attention to and talk about and reward and model in their behavior tells us what it is that they value. So if we are to create more compassionate cultures in our schools, in our communities, then our leaders must embody compassion in their leadership. And that means leaders being present with those they lead, listening with fascination, seeking to understand the challenges that they face. And as Owain made clear in his introduction, staff have faced incredible challenges over this time, but we also know that levels of stress amongst school staff and school leaders are unsustainably high. So seeking to understand the challenges that people face is key, and the challenges that learners face. And that understanding is achieved, as I said earlier, not through imposing some understanding from some elevated hierarchical position, but through having a dialogue and exploring the differences between our perceptions. And it's leaders having the emotional intelligence and the courage to empathize with those they lead, to feel their difficulties and pains. And that gives the motivation for the fourth element of compassionate leadership, which is helping or serving those we lead. And in the context of schools, that's helping teachers by helping to do their jobs more effectively, by helping to remove the obstacles that get in the way, and by helping to ensure they have the resources they need, the right numbers of staff, the right skills, the right training, the right equipment. And this is not, I should emphasize, some new fancy model of leadership. We've known for 60 years that these four behaviors are critical to effective leadership. The most important skill of any leader is listening. And the most important task of a leader is helping those they lead to do their jobs more effectively. And we know that this is what predicts outcomes in organizations across sectors. So, for example, research such as that by Ben Schneider over the last 20 years has shown what's called the value, he calls it a value chain from these leadership behaviors to outcomes. For example, in the retail sector, demonstrating how when leaders behave in these ways, staff are more satisfied and engaged, they provide better customer service, customers are more satisfied and loyal, and it affects productivity and profitability. And this has been well demonstrated over time. In the research I've been involved with across the healthcare systems of the United Kingdom, And particularly from the data we've gathered in England, we've been able to identify a similar value chain. So I had the privilege of being involved in the design of a national staff survey for the English healthcare system in 2003. And that survey has been run every year, including 2020, since. So we've got 18 years worth of data. Over 500,000 people complete that survey every year. We've got we're able to do with this amazing data set, the most sophisticated statistical longitudinal analysis. And what it reveals is exactly the same value chain. So when staff report their leaders in NHS organizations are behaving in these 4 ways, that affects subsequently staff satisfaction and engagement, which affects patients' satisfaction with their care. It predicts care quality and lower levels of avoidable patient mortality. When staff report that their leaders are generally not behaving in those 4 ways, that subsequently is related to chronic excessive workload, high staff stress, patients reporting being treated with less compassion and respect and dignity, and it's associated with worse care quality, worse financial performance, and much higher levels of avoidable patient mortality. So for all of these reasons, compassionate leadership, I think, is core to our future of how we transform our schools, our organizations, our communities. But it's important to emphasize, really, that this is not some soft cushions, sort of scented candles approach to leadership. On the contrary, I think it requires much more courage and authenticity to lead compassionately, because our compassion is for the learners, the communities, the staff that we lead. And so that implies a really strong focus on performance management and dealing with difficulties. Compassionate leadership for the future is about effective leadership, inclusive leadership, collective leadership, and leading across boundaries. So we must transform our organizations and schools to create this kind of leadership. Effective leadership can be understood as about ensuring direction, alignment, and commitment, that we as leaders ensure that we're articulating repeatedly and bringing attention back to repeatedly our overall purpose in education, to enable young people to grow, to fulfill their potential, to have happy lives where they feel safe and loved and engaged in life, experiencing the mystery and the miracle and the wonder of their lives in a hungry way. And it's about also ensuring alignment of people working in teams and in our schools so that their efforts are aligned around that purpose, not being dissipated on unnecessary bureaucracy or petty conflicts, and ensuring that we're creating commitment, the trust and motivation of people. And that's what compassionate leadership helps us to achieve. And if leadership is not inclusive, then it's not compassionate. Compassion and inclusion are like two sides of the same hand. They're both about belonging. You know, if a little girl is excluded from her friendship group in the playground, we know it has an impact on inflammation of the central nervous system with real health consequences. We know that when people are excluded over the lifespan, people with disabilities, people from minority ethnic groups, people from lower socioeconomic groups, that there's a biological weathering effect that results in negative outcomes and early mortality. And we saw the impact of the pandemic on infection rates and mortality amongst people with disabilities, from lower socioeconomic groups, from minority ethnic groups. So inclusion is a hugely important issue, but it's also a performance issue. We know that diversity of teams and staff and leaders is associated with higher levels of productivity and innovation. Why? Because we have a more a greater, if you like, treasure trove of knowledge and skills and abilities to draw on when we have diverse teams and organizations. And in the context of compassionate leadership, inclusive leadership is about, does everybody feel from my leadership equally attended to, understood, empathized with, and helped? So we must build, we must develop, we must sustain inclusive leadership as we transform teams and organizations for the future. And in compassionate leadership is also about not seeking to be liked, to be nice, to be more, so I can be more powerful. It's enabling everybody to feel they have leadership responsibility, learners, students, staff. You know, one of the, I think, great ironies, you know, when I look at health services, for example, and I think to some extent it's similar in education, but in healthcare, we have one of the most motivated and skilled workforces, and certainly the largest in the whole of industry. Yet we continue to manage people largely through extended hierarchies and command and control. The most effective organizations in the world in any sector, we know, have no more than 3 or 4 reporting levels. Yet in the typical NHS organization, reporting levels are in double figures. How many reporting levels are there in your school? We should be seeking, I think, to create flatter, less hierarchical structures with more team working, team-based working as a way of structuring our work in organizations. It's about shared leadership in teams. We may have a hierarchical leader, but that person's role is to bring in everybody's knowledge, skills, abilities, experience to bear on our thinking. And compassionate leadership is about working compassionately across boundaries. We know that what predicts organizational, school, healthcare organization performance, as much as how our teams function, is also how different departments collaborate, cooperate, support each other, different teams support each other. So compassionate leadership is about working compassionately across boundaries, always asking the question, how can we help you? So that together we deliver for the communities that we serve. So compassionate leadership is about creating cultures of presence, attention, and listening. And we know it's about ensuring that these key cultural elements are present in our organizations: clear vision and values, clear goals and performance, a focus on learning and innovation about the organizational community, the school community, as well as learning being a process, support and compassion for all, equity and inclusion, and building team working, which has been the hallmark of our evolution as a species. Now, at the outset of our discussions this morning, there's been a lot of talk about the well-being of leaders and the well-being of teachers, and indeed the well-being of students. We've seen over the course of the last 2 years the impact of the pandemic on mental health in our communities. And I want to focus on these issues to do with staff stress as a second, if you like, key theme that I think we need to learn from. The levels of stress that we're seeing are beyond yoga. They're beyond mindfulness apps. I've had the privilege over the last 4 years, first of co-chairing an inquiry on behalf of the General Medical Council into the health and well-being of doctors across the United Kingdom, and then 2 years ago, on behalf of the Royal College of Nursing Foundation, leading an inquiry with my colleagues in the King's Fund into the mental health and well-being of nurses and midwives across the UK. And it was clear from all of our research that addressing the problems of health and well-being and stress at work, it's not about yoga and mindfulness alone. I'm not seeking to denigrate those activities. When I was an undergraduate at Ngholeg Brifysgol Abertawe back in 1971, I learned meditation, and it's been a central part of my life ever since, but it's not enough. And what our research in these inquiries has shown us, and others' research has shown us, is that stress at work and motivation at work are a consequence of our failure to meet people's core needs in the workplace, and there are 3 core needs that we have to meet. They are the needs for autonomy, belonging, and contribution, and all 3 must be met for people to be well at work. So the point I want to make is that it's great having health and well-being programs, but we must also address people's core needs at work if they're to be well, healthy, and intrinsically motivated. The first is the need, and this applies to learners, to students, and to staff, and to leaders in education, that we have a need to feel we have control, that our voices are heard. We have voice and influence. We're not just cogs in the system being directed. We must work in environments that are characterized by a feeling of justice and fairness and openness, rather than what we heard in many healthcare organizations was staff feeling that they worked in contexts of fear and blame. Because feeling that we work in places of justice and fairness and openness gives us a feeling of control. And it's about having influence over our working conditions, that, you know, we have the right equipment, we have pleasant places to work in, both as staff and as students, and that we have also, you know, we have the opportunity to take rest breaks when we need them, proper breaks free from the demands of work. We have the opportunity to influence our work schedules so that we can better balance our work and home lives. That's what autonomy and control and influence are about. And second is the need for belonging, which I've talked about a great deal because it's so core to our experience as humans, that we need to feel valued and respected and cared for in our schools, in our teams, in our departments, by our colleagues, by our leaders. All of us need to feel that, and we need to feel that the cultures that we work in are fundamentally compassionate cultures which promote that sense of belonging. And as Owain mentioned, I have the privilege of now working with Health Education and Improvement Wales on their 10-year strategy to develop compassionate leadership across the whole of health and social care. And I think that should be across the whole of public services, because that will have an impact on the cultures of our communities across Wales, reinforcing what I think is already a profoundly important cultural value in Wales of community and belonging and caring. And the third is the need for a sense of contribution, that we need to feel that through our work, we're making a positive difference to the lives of young people, to communities, to the people that we lead. And the number one factor we found in our inquiries in healthcare, which impedes that, and that was mentioned in Dr. Alice Davis's report as a key factor, as the key factor also, is chronic excessive workload. It's the number one factor in staff stress. It's the number one factor in staff intention to quit. And in the healthcare sector, we know it's the number one factor associated with patients' dissatisfaction. I think it's a bit like, and I applaud Dr. Alice Davis's report, I think it's a bit like the pattern on the wallpaper that we no longer see. Yet we must talk about it because of its huge impact in the system. You know, chronic excessive workload has real impacts on staff health, on cardiovascular disease, on addictions, alcoholism, cancers, diabetes, depression. And we must address this. It must be a subject of every leadership meeting, of appraisal meetings, so of departmental meetings to address this issue. And of course, it's an issue of having adequate numbers of staff, and the work in Wales to ensure adequate staffing in public services, I think, is hugely important. It's well ahead of work in England, where the UK government is still refusing to deliver a workforce strategy for healthcare. But it's also about asking the question, what can we stop doing? What can we get rid of? What's unnecessary? You know, it's an important insight into human behavior that when people are asked to improve a system, I don't know, an appraisal system or a recruitment system or an examination system, the tendency, 95%, or even a Lego building, 95% of people add something to it. So we just increase processes rather than often the solution is taking away. I work with East London Foundation Trust, a huge mental health and learning disability trust in East London, very challenged area. And they regularly ask their staff what they would reduce or get rid of. And they've eliminated 85% of the bureaucracy associated with clinical audit. It's also about better team working and using technologies more effectively. But we must address this issue. So the point I want to make is that I know there are many examples across Wales in education where one or more of these needs are being well met. And there are many examples that I see in healthcare across Wales and indeed across the United Kingdom. And it's really important that we learn from those and fundamentally address the core needs of those at work that we work with. I particularly want to address the importance of team working. You know, when I finished my PhD in 1977 at what was then UIST in Cardiff, I went and worked for a year in a coal mine as a labourer in Oakdale Colliery, which was then the biggest coal mine in South Wales, and reached the pinnacle of my rugby playing career by playing inside centre for the second 15 team in the local team, a minor league team, I should add. But what I learned during that year working underground was team working was fundamentally important to my safety, that it's the teams that we work in, the departments that we work in that make such a difference. And actually what we've seen over the course of the pandemic is that it has been people's immediate work team, their immediate department, that has made all of the difference to being able to cope. We must build better team working for the future because it is such an important predictor of organization performance and of staff well-being. And it's about getting the basics right, of course. I'm not going to go through all of this because it'll be familiar to you. It's about aligning around an inspiring vision of what we're there for and having 4 or 5 clear goals, not 45. It's about ensuring that we develop compassionate, supportive relationships in our teams. Of course, people fall out from time to time in families and work departments, and then we work through it and we make up and we're stronger for it. It's the chronic interpersonal conflicts which are so deeply, profoundly corrosive to our effectiveness as teams and organizations, and to our well-being. And it's also important to ensure that we emphasize inter-team, interdepartmental working. Every team, every department in education should have as one of its 4 or 5 objectives improving the effectiveness with which we work with the other teams and departments in our organization. I think we should be building the skills of team working and understanding well-being and compassionate leadership as well into the curricula for our students. It's happening in healthcare. HEIW in Wales is ensuring that foundation doctors in the northwest of England are being trained in compassionate leadership. And of course, we've had these particular difficulties of working using the technologies that we've had a little bit of a grapple with this morning. And I think I just want to mention how we can work it more effectively in teams using these new technologies. What we've learned over the last 18 months is we need to continually, when we meet over the web like this, is we must reinforce continually that shared purpose and direction and reaffirm that in our meetings, embrace these new ways of working, not simply resist them. Because the problem with these technologies is that we tend to become much more agenda focused, much more task focused. So it's about making sure we take all the more time to say thank you to people, to celebrate team departmental success, to say, to appreciate contributions. It has such an impact on well-being, and the emotional ripples of gratitude spread out, and people are more appreciative of each other. We know that human beings underestimate how powerful their expressions of gratitude are on others. And it's about showing that we care in these meetings. I know you've been under real pressure. Chris, is there anything I can do to help? Or, Nia, I heard that you had a bereavement in the family. I'm really sorry. I want you to know I'm there for you. Is there anything I can do to help? It's really important that we take the time in these, particularly in using these technologies, to do these things. And the time for sharing and chat and laughter is really important. How was your weekend? How did your daughter's birthday party go? This stuff connects us and gives us that feeling of belonging, which is fundamental to our well-being as human beings and our life experience as human beings. It's all about relationships and connection. And it's about ensuring everybody is enabled to contribute when we're using these technologies, bringing everybody in. And the other, I think, important lesson from the pandemic is when we're in crisis, all the more must we take time out to stop, to huddle together, to reflect, what can we learn? I've been working now for the last 30 years on aspects of team working, among other topics, learning from my experience underground, and learning that, I suppose one of the issues that I kept seeing was teams, departments under huge pressure. And we asked the question, what happens if they take time out on a regular basis? And all our research over the last 30 years in a variety of sectors and other people's research around the world has shown the truth that teams and organizations and people are more productive and effective and innovative when they regularly take time out to reflect and learn and adapt. This pathology of the hamster wheel in organizations is indeed a pathology. We spin this hamster wheel, and when the going gets tough, we spin it faster, and it's counterproductive. A meta-analysis based on 49 separate published studies showed that teams that do this on a regular basis are between 35 and 40% more productive than teams that don't. Partly because they're smarter, they're more innovative as a consequence. And it's really important, I think, we learn from this. So I've emphasized compassionate leadership, the importance of meeting the core needs of staff at work, time for stillness and reflection, and the quality of team working that we develop as key for transforming teams and organizations for the future. So I'm not going to go through all of this. It's just a summary of what I've been saying. I had the privilege over the course of the last 2 years, with the wonderful support of Health Education Improvement Wales, of trying to bring together all of our research in a book focused on compassionate leadership, particularly focused on how we develop wisdom, humanity, and presence in health and social care. And you'll find lots of practical resources in there, many of which I think are applicable to the educational sector. But I want to finish by emphasizing that the first step in all of this, if we are to lead compassionately and to transform cultures, organizations, schools for the future, the first step is for leaders to have the courage to be self-compassionate. And, as was said earlier, what we often hear is people very much, leaders and school and teachers, very much focused on the health and well-being of the learners, of the students, of young people, and neglecting to focus on their own health and well-being. But our compassion for others is based in our compassion for ourselves, that we must sustain ourselves in order to be compassionate to others. So I think it's important that we practice self-compassion and learn, for example, how we recover from stressful work days. My colleague in the University of Mannheim, Sabine Sonnentag, has for 20 years been focusing on activities that aid recovery from work. And they're what you would, I guess, expect intuitively. But they show that when we finish work, we need psychological detachment. We need to have that, I don't know, watch a Netflix series, read a book, but to detach from work. We need times to be still, relaxation, meditation. We need activities that give us a sense of mastery, cooking a nice meal, or a sense of achievement or effectiveness. We need to have control over what we do in non-work time, rather than just having another layer of tasks that we've got through. And proper lunch breaks, proper work breaks are really important for recovery. In healthcare, we know that proper work breaks predict patient safety. Proper work breaks for staff predict patient safety and the level of errors. Physical exercise, of course, but also we now know so much more about the profound effects of spending time in nature, you know, and the hierarchy of effects. The most powerful are blue environments, lakes, rivers, the sea, closely followed by green environments. This is a picture of a reservoir not so far from my house, about 4 miles away here in Sheffield, mixing green and blue environments, and then urban green environments, parks, and even getting outside at all, being under the sky, helps our well-being. And we know that those whose work is most stressful are least likely to engage in these activities. Self-compassion is also about putting into practice what we know about human well-being, the 6 ways to well-being. By far the most important is spending quality time with the people we love and who love us. The research evidence says that catching up, literally and metaphorically, is profoundly important for our well-being. The others will be familiar to you. I just want to say, getting enough sleep is not some optional. 95% of people need, 98% of people need 7.5 to 8 hours sleep a night. We can't cheat out nature. So it's really important we practice good sleep hygiene. And giving and helping others, as I said at the beginning, is really important for our well-being. So we must all have the courage to practice self-compassion, to be self-aware in the moment, particularly as leaders, to know when we're feeling, you know, to be aware, to pick up on when we're feeling angry, irritable, overwhelmed, inadequate, ashamed, and indeed joyful and connected, and to accept those feelings rather than feel guilty about them or feel inadequate and push them away. And then to inquire into them. Why am I feeling like this? Oh, I just had that slightly unpleasant interaction with a colleague. And then to bring a nurturing, caring attitude towards ourselves. After all, each of us is as deserving of love as every other human being on the planet. And when we have the courage to attend, understand, empathize, care for ourselves and help ourselves, we in effect connect more deeply with ourselves, with our being, and with the core values that give our lives meaning, like compassion and wisdom and courage. And when we connect more deeply with ourselves, that enables us to connect more deeply with all of those we lead, all of those that we provide education for, and in fact, with all of those we interact with. So all of this begins with having the courage to be self-compassionate. So diolch yn fawr i chi gyd. I'm very grateful for the opportunity to share these thoughts with you this morning.